What?
It makes sense.
Yeah, let's come back and give a tour of it. On that.
Good morning, everybody. My name is Bill Tarver. I'm calling the Kane County Public Health Committee to order. Can you please call a roll?
Arroyo. Juby.
Juby here remote.
Hennessis.
Hennessis here.
Carver. Sanchez.
Sanchez present.
Roth.
Roth here. And Mr. Young is joining us too.
You haven't even called my name yet.
Young.
Well, I'm
Is
usually
there
the
any
last one
action?
called. I was the last one, normally the last one called because I'm ex officio.
All right, could I also get an approval for Ms. Juby, who request a remote attendance request, please?
No problem with Ms.
Thank
Juby.
you. And then next, can I get an approval for the minutes of June 18th, 2025?
I request unanimous consent to approve the minutes.
Anyone opposed? Excellent, thank you.
Good morning, Dave.
Next up are public comments. Lori Powell. Good morning. Lori, you'll be given 3 minutes, okay?
Good morning. I'm Lori Powell. I've been a resident of Kane County for the past 23 years. At the beginning of 2025, the Kane County Public Health Department finally provided a link to VAERS, the Vaccine Adverse Event Reporting System. This request was made for many, many months. It is great that there is information informing the people of Kane County of adverse reactions to vaccines. However, informed consent is still severely lacking when it comes to vaccines. So today I'm here to make another request for a link on the immunizations page. Currently, there is a link to the State of Illinois Certificate of Child Health form. Another very informative and necessary link to provide to all parents is the Illinois Certificate of Religious Exemption. This form is on IDPH's website, so why is it not on Kane County's health website? This is a very reasonable request. All parents should be informed of this document and have easy access to it, just like the easy access to the health certificate form. So I did send an email to everybody on this board, and there's a link to that PDF. So if you want to look at the form that I'm talking about. So my request once again is to put this on the website as soon as possible. Thank you.
Thank you, Lori. Next up is the Finance Monthly Report. I believe that is on file. Okay. Are there any questions regarding that? Okay, seeing none. Next up, Animal Control.
Good morning, everyone. All my reports are on file. Please let me know if you have questions. I have a quick presentation of some updates for everybody. So hopefully we can show you what's going on. Perfect. Next page, please. First thing we have is our backup generator. Hopefully, fingers crossed. NICOR was supposed to be at our facility between 7 and 9 today to install the new gas line. I apologize for not knowing enough about gas lines, but they're going from a 1-inch to a 2-inch to increase the pressure for this machine. That's as far as I was able to understand. So hopefully it's being finished today. Once that line is installed, the contractor is at the facility. They were there when I left this morning, ready to finish the install. And hopefully this is done today and Animal Control finally has a backup generator and we're good to go. So we're very excited about this being completed. The next one, our dog water fountain. So we are moving forward with this. We've already spoken to some people, gotten some estimates, some quotes. This in yellow is the aerial view, and in yellow you can see where we're looking to put this. This will be a 10 by 10 pad, and on the right you can see the water fountain that will be installed in the center of it. Blair, if you flip to the next page, please. This is a quick breakdown, and I apologize. I am not a graphic artist. I am a veterinarian, so I tried to hopefully make this where everybody could understand. There will be 2 benches. And there will be the dog water fountain in the center. We're trying to make this a nice, comfortable area that people want to bring their animals to. We have that beautiful Geneva Peck Farm path right next to our facility that tons of people use. One of the things we've heard from people over the years is how nice it would be to have a water fountain. When they took away the poop stations, for lack of a better term, on the path, we had one installed. That's our dog station you see there, to make sure people had the ability to receive bags for their dogs, again, to help cleaning up. This is just another feature we're so glad to do. And this was that $10,000 donation that was approved in that resolution back in January of this year. We're just finally able to start breaking ground and getting this going. So we're very excited to get this put in. There will also be a plaque on there thanking the trust and all the wonderful people, because beyond the trust, this is also other cash donations we've received to help fund this. So this is hopefully going to be a very nice area for the community, also great for our animals when they go on a walk. So it's a win-win, not only for the shelter, but hopefully for the community as well. And that's what we're really trying to do here. Next one. We do have 3 remaining clinics coming this year. We're very excited. At the bottom, you can see our totals to date. We've done 280 dogs, 77 cats, and 57 microchips. I did break it down into senior numbers in case people are curious. But again, we're very excited to get going on our last 3 of this year. So please come out, visit us. If you know anybody that needs it, please. If you need flyers to hand out, please let me know. I'd be more than happy to bring more flyers to you or get flyers to you. We're just always trying to get the word out and continue to grow this for the great people of Kane County.
Is that senior dogs or senior?
No,
people?
senior people, yes. Senior citizen people, 65 years of age or older. The reason this is a low-cost clinic, this is meant for people that need this, and especially in the senior community. $15 for the rabies really is the cheapest you're going to find in the county. The next starts at $20. We are trying to ensure that we help as much as we can and give back and still be able to ensure that it's a sustainable clinic to fund itself, so we don't have to start stressing about how we're going to get funding to keep doing this every year. And to date, it's fully funded, all the overtime of the staff, all the vaccines and everything.
Thank you for doing it.
I just paid $69 for a rabies shot, so this is a bargain.
So yes, they are very expensive. We're just trying to make sure we do our part to at least help those that need it within our community. And then the last page we're very excited about. This is Dr. Allen. Dr. Allen Hertz will be coming to visit you one day. He had literally just started January 1st. I didn't want to overwhelm him. He is currently a veterinarian at Bethany Animal Hospital. We are so excited to have him on board. We're sad to lose Dr. Jane Davis, but we're very excited about Dr. Allen here. He has a history of mixed animal practice, production companion. He really has a great background he's bringing, because Kane County really has that mix of farm and small animal. And having a veterinarian that understands that and is able to go between the two is going to be a huge benefit for this county. Dr. Davis was amazing at that. We're hoping Dr. Allen Hertz continues to do that as well, and we know he will. So we're very excited. Once he gets settled, I will be bringing him to a board member meeting to meet everybody. I just didn't want to overwhelm him too well at first. Our busiest holiday of the year is July 4th, as you can imagine. So 3 days after he started, we got hit with all of our straying animals running loose, and other issues throughout the community. So I just want him to settle in a little bit before we scare him too much. And that's all I had for my update. Does anybody have any other questions? Please.
Mr. Gregg?
I love the dog fountain. There's a similar kind of structure in downtown Wheaton. And you may not know this, doesn't really matter, but how tall is the one for people?
People, I would assume about 3 feet. I don't want to say the wrong thing, and I apologize.
Okay,
I did
no.
research into the.
So
people.
here's my suggestion, that we create some kind of, so we can water dogs, we can water adults. We can't water kids unless they want to get down where the dogs are, which is probably not a good idea.
This won't have an adult water either. It's just animals.
Oh, the tall ones for animals too?
Can you flip back up, Blair? I apologize. That one right there is just a dog water fountain.
Oh, there's nothing on the top.
Oh, there's
Right,
nothing
no
for
fountain on
people.
the
No,
on-
because if we do a people one, we have to connect it to a different water line within the building. We have to meet certain standards. We have to put in certain filtration. There's a lot of rules that start to come in play. We already have one right inside the building that is human approved and has been there forever since the building was built. We didn't have one for animals. We thought about putting it in the building, but there's no drain there either. So this is the reason we focused on just for the animals outside, because people can always come right inside the building. Also on multiple past and forest reserves, they have the water fountains for the humans already. We wanted to make sure that there was something for the animals here.
Okay, you and I have talked about a scent trail
Yes.
from here. So would that go from, we're looking at the picture from the left of the yellow out?
Actually, it would go from where the end of the sidewalk is on the left. It
Got
would
it.
connect right from there. So it would still be a part of it, but it would be a continuation off that sidewalk to meet where the Geneva Trail starts.
Okay. With the benches, you might want to, I know, like in the latest couple of days, no one would want to sit on those benches because, it's hot.
Mhm.
If we could plant a tree or something
Oh,
nearby.
I could definitely talk to building management.
Yeah, get somebody to do that. We might even find a donor who would love to,
Yeah, I think
support
that'd
the
be a great
animals.
idea to give.
So people
provide
would
some
want to
shade.
sit there.
And
What's
and the dogs would love the tree too.
Yeah, absolutely. Well, whatever. What's the tall part of that thing for then? If it's
That's
not a-
where the water piece for pulling the water in. Also, what will be on there is a locked spigot. I don't know the proper term of the hose piece. Will be secured so that we can attach a hose and clean the concrete, clean the benches. So there will be additional water features on it, but it's going to be locked up so that it doesn't get abused. One of our biggest fears is someone turning it on, walking away. And unfortunately, the price of water in Geneva is very expensive. So we tried to ensure that if something does go wrong, we have full controls. One of the things this company we're going to work with to get this installed, we're going to bring actually the controls inside the building. So in winter, we can fully shut it off. We're going to do a Labor Day to Memorial Day to ensure that we can flush the line of water so it doesn't freeze. Yeah, we've talked through building management and with the contractor about how to ensure that this, again, we want to put something in that's going to stay. It's going to be easy to take care of, easy to maintain, and works, because I'd hate to put something in and in 5 years, we're like, oh, that was a great idea at the time. I want something that's going to last and make sure that we do this appropriately.
Thank you.
Of course.
Any other questions? Thank you, Brett.
Thank you.
And then you have a resolution also?
Yes, we're hopefully bringing forth our last credit card resolution. I have fought tooth and nail to get this down to the lowest percent rate possible. Illinois ePay is our vendor we've chosen. Actually, multiple animal controls in the area already use them. We've talked to the animal controls. We've seen what they're doing on the website. We've talked to Illinois ePay. It's actually very easy to use, very simple. It's great that it's part of Illinois too, to keep with the government system. We're very excited. This is going to get us online payment. And what's great is the percentage rate of the dollar minimum does not go away. And that's one of the things we are trying to get rid of. Clearly, that is a new standard in credit card distributors that isn't going to go away soon. But what we did do is after that dollar minimum, we got it down to 2.25%. That is a huge savings compared to 3 and much over 3 that we've seen. So at least we were able to get as much savings as possible for our citizens. And that's what we're trying to do. What we're most excited about, of course, is getting this online. And if you use check payment, I forgot what the terminology is, Mr. Gripe, you probably know, ACH, I believe, the fee is even lower. So it is a way to keep down fees, allow people to be able to do this from their living room or their bathroom, I guess, if they choose. But a way that we can help the citizens of King County not necessarily have to come to our facility. Finally jumping into the 20th century, sorry to say it that way, but we are, and finally get this moving forward. We're very excited.
Well, wonderful. So can we get a motion to vote on resolution TMP 25-872?
Pennis is second.
Excellent. Any further discussion or question for Brett? Seeing none, clerk, can you call the roll, please?
Juby,
Juby abstain.
Genesis,
Pennis is yes.
Tarver,
Tarver, yes.
Young,
Yes.
Sanchez.
Motion passes. All right. Thank
Thank you, everyone.
Next up is the executive director report. I don't see Mr. Isaacson. Who do we have?
Rise. Yes. So my name's Liz Alleman. I'm the Director of Planning and Information Management. Michael is on vacation this week, so he asked if I could come here and actually introduce 2 of our newest members to the Health Department. So behind me, I've got Nazreen Wakile and Rick Vanderforest. Nazreen is the Affordable Housing and Continuum of Care. Thank you. I'm sorry, I had a brain fart. Program manager, and then Rick is the program manager for the rental assistance program. So they're new to us. They're obviously not new to the county, but we are very excited to have them here today. So I'm going to invite Nazreen to come to the microphone first, because Nazreen has some slides that she would like to share with you guys about the continuum of care.
Good morning. I see some familiar faces from development yesterday. And to those of you who are not there, nice to meet you. I'm Nazreen Wakile. I've been working for Kane County for almost 7 years now. I've been managing Continuum of Care and a couple other programs that were under OCR for a few years, and now transitioning over to the Health Department. So I'm happy to share some of what COC, is the acronym for Continuum of Care, does. Next slide, please. So the Continuum of Care is a federal program which is designed to promote community-wide commitment to ending homelessness. So the funds for Continuum of Care come from the Department of Housing and Urban Development and are allocated directly to the county to administer and plan for the Continuum of Care. So we are responsible for coordinating the local efforts to end homelessness. So I will say those grants that we receive directly are only for planning, operations, and our software management. The housing grants are directly between the federal government or the state government and the provider of those services. So the grants are not administered by the county. Next slide, please. So our service area for the Continuum of Care includes all of Kane County and then also all of the parts of Aurora and Elgin that fall in other counties as well. So Kendall, Cook, DuPage, and Will County are also included in some parts of the Continuum of Care jurisdiction. So any individual that presents as homeless that comes from within those jurisdictions is eligible to receive Continuum of Care services. Next slide. So we have almost 30 member organizations within the COC. Many of them I'm sure are familiar to you. They include local government, veterans organizations, mental health and homeless shelters. These also comprise our Continuum of Care board. One of the tasks of the Continuum of Care is to establish a board of directors who is responsible for the governance of the Continuum of Care. Kane County, the city of Elgin, and the city of Aurora have permanent seats on that COC board because they are funders of the COC program. Kane County designates an allocation of CDBG funds to administer the program, and the city of Elgin and the city of Aurora also allocate funds for the program. So they have permanent seats. The rest of the seats have 3-year terms and are represented by various member agencies throughout the county. So Hesed House, Pads of Elgin, AID, any type of stakeholder is eligible to serve in that role. Next slide. So what do? We manage federal and state funding opportunities for initiatives to address homelessness. So the Continuum of Care is notified of a funding opportunity either by the federal or state government. And we are responsible for operating our internal application process. So what I will do is I will send out a notice to all of our members that there is a funding opportunity available. I will collect those applications, evaluate them, and present them to our COC board. The COC board is ultimately responsible for making those funding recommendations to the state and federal government, who will then either accept or turn down, which has never happened. But essentially, they could say they don't want those, those agencies, I suppose. And then, like I said, the agreement would end up being between the state or federal government and that local service provider. So in addition to managing those funding opportunities, we're responsible for the annual point in time count, which is a census of people experiencing homelessness on a single night in January. So the federal government dictates that we conduct this census during the last 10 days of January. The idea being that anybody who has somewhere else to go will probably be somewhere else because that is essentially the coldest time of the year. So myself and other volunteers, local police departments go out. We have our census forms that collects demographic information, and we go out and individually survey people who are in known locations of unsheltered homelessness. And then we collect all of that data utilizing our software system from our emergency shelter providers as well. All of that information is packaged and then sent off to the federal government, and then Congress receives a giant report on homelessness, which is probably what you guys have all seen in local news and national news, you know, this 18% rise in homelessness in 1 year. That's all compiled on local data and local efforts from your Continuum of Care. So in that vein, we also manage our homeless management information system and coordinated entry system. So that homeless management information system is basically the case management software that Continuum of Care are required to utilize because it reports directly back to the federal government what we're doing at the ground level. So all of the demographic data you see about people experiencing homelessness comes from HMIS. Additionally, we're responsible for organizing the coordination of stakeholders, identifying local priorities and strategies to target them, and then trying to create an accessible portfolio of housing programs. So we just completed our 2025 homelessness report and needs analysis, which I'd be happy to share with anybody on this committee who's interested. But it basically takes a look at the demographics and population of people experiencing homelessness in Kane County, subpopulations, so veterans, DV, disabilities, et cetera. And then it also assesses our most urgent needs. And we take those findings and I bring them to our COC board, and that's kind of how we prioritize funding opportunities. We say, okay, the biggest needs in our community, for example, right now are permanent supportive housing, expansion of emergency shelter services, and expanded access to mental and behavioral health services for people experiencing homelessness. So now we take those findings and we tie them together with our funding opportunities and say, you know, projects who can demonstrate A, B, or C will be prioritized for funding. Next slide. Oh, I got ahead of myself. Next slide, please. All right, so this is our 2024 snapshot. I do have more up-to-date data, but it wouldn't cover all of 2025. So this is the data for 2024. So 1,717 individuals, adults and children, utilized emergency shelter in Kane County in 2024. 44 were veterans, 144 were youth aged 18 to 24. There were 300 households fleeing domestic violence. 372 had slept outside at some point. So 372 roughly experienced unsheltered homelessness. Nearly half of those folks indicated having one or more disabilities, and 561 of them were families with children. So over a third of the people experiencing homelessness in Kane County were families with children. 110 were under 5. 174 were between 6 and 12, and 103 were 13 to 18, with a total of 387 sleeping in shelter in 2024. Next slide, please. So I've also provided here just a history of homelessness in Kane County. Basically, since 2017, which was one of the first times we did the point in time count, up through our most recent point in time count from January. So you can see here this initial count of 360 in 2017 up to 582, which I'll remind you all only reflects a single point in time. So those numbers changed year to year, but on our one day, we've seen such a significant increase. 2021 being the outlier because all of our shelters were operating at minimal capacity due to the COVID-19 pandemic. So they were operating at a very significantly reduced capacity. Other than that, you'll see that we've been on a pretty steady upward trajectory for quite some time. Next slide, please. So I won't get too into the minutia on this, but part of what continuum of care are required to do is establish a coordinated entry system, which requires that we identify an assessment tool that is given equitably across the county so that folks all have the same shot at accessing these services. So the tool will basically generate a score, and those individuals will be prioritized for housing based on the score they receive. That assessment tool takes into consideration how long they've been homeless, any disabilities they have, are they, health conditions, do they have children in the household, etc. Next slide, please. We have a variety of access points where people who are experiencing homelessness can approach and get enrolled in this coordinated entry system so that they can get on that housing priority list. I'm sure you guys are familiar with most of them, so I won't list them all off with you, but we have quite a variety of access points, including Kane County. Next. So for eligibility, a person does have to be experiencing literal homelessness in order to be eligible for continuum of care federally funded services, which means they have to be either sleeping outside or sleeping in shelter. There are other types of state funding that allow for people to be at risk of homelessness in order to be eligible, but for all of the federal funding that we receive, they do have to be literally homeless or fleeing domestic violence in order to receive those funds. State is a little more flexible, but the federal government is pretty strict on that. Next slide. I kind of went over that already too. Next slide, please. So we deliver a variety of programming. The first is diversion and prevention. So this is to try and stop people from even entering the homeless system. So diversion and prevention can look like helping people catch up on their rent, mediating their relationships with family members or friends to try and get them to find a different place to stay, hotel, etc. Rapid rehousing, which Rick is going to talk to you guys about in a bit, is a medium-term rental assistance with medium-level supportive services, 12 to 24 months, depending on the funding source, with a variety of providers within the community. Next slide. Permanent supportive housing is our rental assistance programs for households with high needs. So these are people who have experienced chronic homelessness and have one or more disabling conditions, which is required by the federal statute, that they do have one or more disabling conditions and have been experiencing chronic homelessness, which means 12 or more months typically. So this permanent supportive housing can last, anywhere from 5 to 15 years typically, just because of the needs of the participants. Next slide. So typically, this is the amount of funding we receive, and it can vary year to year, depending on the generosity of Congress and the state legislature. So our continuum of care funding, so the funding we receive directly from HUD, is somewhere usually between 2.5 and 3 million. The COC staff directly here at the county receive about 250,000 to operate the program. The rest is distributed throughout the county for those housing services. Next slide, please. Emergency Solutions Grant is technically a federal resource, but the county itself is not an entitlement community for that funding source. And so the state gives us an allocation annually of about 300,000. Eligible activities for this are street outreach, emergency shelter, rental assistance, and HMIS. Next slide, please. Homeless prevention. The state of Illinois has put a significant level of emphasis into expanding the availability of homeless prevention services. So when I started in 2018, our annual allocation was 230,000. This most recent year, which just started on July 1, we received about almost nearly $1 million. So it's even an increase from this number. So the state of Illinois has put a significant level of emphasis on expanding this service to reduce the amount of folks even entering the homeless system. Next slide, please. Home Illinois is also a new grant provided by the state of Illinois. We get about 820,000 for rapid rehousing, 370,000 for permanent supportive housing, and 150,000 for shelter diversion. Next slide. Our grant cycles typically operate from January to April for our state grants because the state fiscal year begins July 1. So we try to make sure we're ahead of that. And then the HUD grant is really based on, HUD's ability to announce a funding opportunity based on congressional appropriations. And so that can vary anytime from May to September. Next slide. We have a variety of committees, our board, our general membership, which is a group of all of our stakeholders. We have multiple committees that are focused on a specific population. So we also have a veterans task force, our rapid rehousing group, our permanent supportive housing group. We also have a lived experience council, which includes people who have experienced homelessness in Kane County, utilize the services, and then provide feedback to the continuum on what their experience utilizing those services was. Next slide. Questions? Yes.
Mr. Penesis.
I have a question and a comment. Thank you for doing this. It's well needed. I was just at Pads of Elgin yesterday. They're cutting back on their space, and you saw the increase we're seeing in homelessness, and they're having to cut back. So it's very, very needed.
It is.
Obviously. Yeah. So HUD funding, it's pretty stable, after, do we know what that federal bill?
So the most recent drama has been that the president and the HUD secretary proposed a skinny budget, which basically was proposing to take the COC program and merge it with ESG. The congressional subcommittee
ESG?
for Emergency Solutions Grant. Sorry, it's another homelessness program.
Nope.
But basically, so the congressional subcommittee met on Monday and they kind of shoot away those suggestions from Trump and the HUD secretary. And so we are on the right track to continue to receive funding for the Continuum of Care program. I think all of the congressional members kind of recognize the value of the program. There were significant cuts to other types of funding, public housing being one, Fair Housing Act, other things of that nature. But COC seems to be in a safe place. There was a slight reduction, but not to the effect of some of the other housing programs.
That's good to hear. Okay, so that point in time count, does that affect the federal funding when you do that count? Is that some way it
It
affect
kind
what
of
we would
affects
get?
us negatively, actually, because they
really?
want to see a decrease. And
Ah.
so when we go out and demonstrate, we have a significant need in the community, we'll actually receive kind of like a ding, like, oh, you didn't reduce homelessness, but
Right.
it's more so the opposite of like, well, actually, we need more resources because the problem is growing. But it doesn't really translate to lower or higher funding allocation. It's more so based on your formula for your population size and how that relates to the size of the homeless population within your population. So as a COC, we get like scored annually based on our performance data, but it doesn't necessarily translate to any increased or decreased funding.
I want to see if you're doing your job and how well you're
Yeah,
doing it.
exactly.
Yeah.
Exactly.
Well, thank you.
Of course.
Mr. Gregg?
Oh, thank you, Mr. Chair. Again, great stuff. I'd only been familiar with the term continuum of care in medical care. So where it goes from, physician to, well, problem to solution. So are we, is the county, what you guys are doing, is the legs on the ground, so to speak, for everything that's done? So the Fed and the state funds this, and it's entirely up to us to administer that money and do things to kind of reduce the housing or the homeless problem?
In a sense. So it's up to the local community to establish the priority needs and then make the recommendations to the state and federal government. We do routine monitoring and evaluating of projects and, funding and grant expenditures so that we know for the next grant cycle, who is, a good steward basically of these federal and state resources because they are, pretty precious for this issue. But technically, those agencies are responsible for it, overseeing their own grant money and reporting back to the federal and state government as well. But I will get calls from, HUD reps or state grant managers like, hey, agency A is not spending their money, let's set up a time to, meet with them and then we'll, hold an intervention. In the event that they are, repeatedly not spending money, we will entertain, a reallocation of resources to an agency who is more proficient at spending their money. That's only happened a couple times though, so.
Okay, two other quick follow-ups. So domestic violence you talk about, I'm sensitive to that very much because my daughter works in that industry. I mean, to help,
Mhm.
right? But how aware are we of domestic violence resources in and around Kane County? That's number one. And then number two, generally relative to that, I'm curious about how we get involved in sexual trafficking, human trafficking to try and reduce that. And then kind of the upper tier is what are our goals for reducing homelessness? If we're just treating the problem, we're giving drugs to,
Right.
to solve an illness,
Right.
which doesn't, cure the
Right.
illness. So I'm just curious if you could.
Sure. So in regards to domestic violence, we have two domestic violence providers primarily in Kane County. We have Mutual Ground in Aurora and Community Crisis Center in Elgin. The Crisis Center in Elgin is a recipient of I think it's almost $400,000 rapid rehousing award from the federal government. They serve about 24 survivors of domestic violence annually with that service. So it's a 2-year rental assistance program provided through the Continuum of Care, but administered by Community Crisis Center. I think one of the slides had the number on DV. I want to say it was more than 300 households annually enter the homelessness system, who have experienced domestic violence. Rick and his team have just submitted a application for a DV specific rapid rehousing program for the county, which will be submitted to HUD. And then we'll get notice early next spring, hopefully, of whether that project is funded. Resources for DV specifically are kind of based on congressional allocation. So it's kind of up to Congress to designate specific resources for DV. Some years they'll say, okay, there's a DV bonus fund for specifically these projects. Other years they'll leave it out. We won't know for this competition until we get notice from HUD about what projects they're prioritizing. In regards to reducing homelessness, so like I said, we've just released our 2025 homelessness report and needs analysis. Piggybacking on that will be our 2025 to 2029 strategic plan, which is currently in the draft phase. I'd be happy to share it with any committee members who are welcome, who are welcoming of that conversation. I can also share the needs analysis. So that project is in its draft phase right now. The needs analysis is complete, but we're taking those needs and translating them into action plans. So what are we going to do for the next 5-year period and to try and tackle these issues? So I'd be welcome to any feedback on all of that. The more minds, the better when it comes to these.
Yeah, I'll touch base with you afterwards because there's domestic violence and human trafficking areas that wouldn't cost us anything. They don't require homelessness to deal with, and they have their own money to deal with that. So I'll chat with
That
you
would be great.
afterwards. Yeah.
Thank you, Mr. Wright. Mr. Young?
Hi, David Young. How many of these people, I saw the increase go up, are illegal immigrants, you think?
I cannot speak to that because that's not information that's required for us to collect by HUD. So that's not information that gets recorded in our homeless management information system. We've had, some guesstimates from emergency shelter providers, but that's not information that's typically collected at an emergency shelter. It's more so just, how long have you been in the area, name, date of birth, and then they get to entering Social Security. So I will say the Social Security function of HMIS is a good indicator of how many folks are, long-term residents of the community. And we don't frequently see entries without Social Security because that's kind of a flag from HUD. They'll say, oh, you guys are missing. It'll be a data quality error. Essentially, if you're missing this many Social Security numbers from people who are showing up in emergency shelter, which we don't frequently receive those reports. So
So homeless people actually know their own social security number?
a lot of times, yes.
Really?
Mr. Sanchez?
Yeah, you mentioned the committees. Are those open to the public or are they just kind of internal committee
So they're open
meetings?
to the general membership members, and the general membership is open to the public. So anybody can submit a membership application and join the continuum of care, and then you would be eligible to serve on a committee.
Okay.
Yeah.
Would you like that information shared with the committee then? Is that what you were getting at?
Yeah, I was just curious about access to those meetings. Is that on your website?
Yes.
Right. Okay. So
Thank you. Mr. Penisys?
Yeah, I just wanted to add, on your website, it says 300 plus households fleeing domestic violence. That's out of 1,717 individuals.
Yes.
So it's at least a quarter, I'm
Yes.
guessing, percentage are fleeing domestic violence.
It's a lot. It's a pretty significant chunk.
Quick question. The amount that you'd said that was taken at the end of January was at 582. Any idea what the number is during the summertime? Obviously, when it's probably hard to estimate, and that does not even include people who are on somebody's couch. It's just outside where people have gone to a shelter.
So there are some communities that do 2 point in time counts. So the only one that's federally required is the one that's done in January. Communities that have a significantly larger capacity tend to conduct these in the summer as well. It's something we've talked about in the past. I could probably get together like a snapshot of shelter occupancy and kind of see and get some boots on the ground information. The unsheltered numbers have changed a bit because of the activities in Elgin of closing down Tent City, moving folks into the Lexington Inn. So those numbers have gone down in Elgin, but we're seeing an increase in the Aurora area. So we actually, Liz and I are going to a meeting today with some City of Aurora staff and community members to talk about homelessness specifically in the Aurora area. And so I'm sure we'll get kind of a snapshot then of what the unsheltered population is looking like there, as well as the occupancy at Hesed House.
Okay, and then a follow-up, the 2025 data mentioned, the report you mentioned, if you could share that with our committee, that would be
Sure,
fantastic.
Absolutely, yeah.
Thank you. Are there any other, yes, Mr. Young?
One more question. How many of these people choose to be homeless? You know, you have that certain percentage that just, that's their lifestyle. I
Right.
mean,
Well, I will
what have you come
say,
across?
so 789, so almost half of the people experiencing homelessness had one or more disabling conditions. So a lot of the times that prohibits people from kind of exiting that system. We do encounter clients who are service resistant, who are not interested in receiving services. So the approach there is kind of to just continually offer services. And eventually, most of the time with that rapport building, people will begin to accept services. Like City of Elgin is a really good example of that. You know, they shut down Tent City. People didn't want to go to the Lexington Inn. Now they don't have enough rooms essentially because people are interested in the services that are being provided and they see the success of people that they had previously known as also experiencing homelessness. So there are, you know, people who are not initially interested in receiving services, and that can last for any period of time. But there are more so just service resistant clients who just need a little nudge, essentially.
Thank you. Appreciate it.
No problem. Anyone else?
Okay. Thanks, Nisreen. And then I'd like to invite Rick to come up and talk about the rapid rehousing or rental assistance program.
Thank you. As Nisreen mentioned,
Closer to the
Hold the mic up.
I'm a little taller. Sorry. As Nisreen mentioned, rapid rehousing is one component. I was hired 5 years ago and I worked in mental health and housing for 35 years between Michigan, Connecticut, and Illinois. And dealt with a lot of mental health issues. And a lot of folks are so busy dealing with other trauma, such as domestic violence or developmental disabilities, that they're just trying to survive. And so when someone is generally homeless, to answer your question, they're traumatized. They have nowhere else to go. And for those that refuse, I have found historically that they just feel like they have no options. But that aside, I just want to mention in 2019, before I came, rapid rehousing served 9 individuals in a whole year for the county. I was brought on to facilitate the growth and accessibility of rapid rehousing. And what has happened since is we've gone from 9 to serving 159 households from 2020 to present. Kane County has been running the rapid review panel that Nisreen mentioned, and I work in a very collaborative methodology. Help each other out, let's find apartments. Some of the biggest things that hold people back, especially domestic violence, is they are trapped. They feel they have nowhere to go and they're scared and they're already traumatized. So getting them into an apartment, we have to, there are 3 of us in the department, by the way, and my 2 staff have been certified in domestic violence. So they work very hard to get them to transition and to be housed in a new setting, and also help them with court services. They have extensive experience in working with DCFS cases. So we actively work on connecting individuals with resources, getting them into housing, and helping them stabilize. Some of the biggest issues, a lot of these folks don't have bank accounts. If you're homeless, you're transitional. And getting them into bank accounts, teaching them how to manage a household, income, develop a budget, and learn how to interact in the community with your landlords, your neighbors, and develop a healthy support network. In doing so, what we found at Kane County, we currently have 23 households that we're working with. Of those 23, 12 households are from domestic violence. So to answer your question, we are actively engaging these individuals and households. In addition to that, there's a large number of mental health issues and addiction issues. So we're actively working with addiction services, mental health, and domestic violence. And we work collaboratively as a team to help the individual. We also, because I've been doing this for quite a while, and I come from a mental health background, we use something called the ACT model, active community treatment, which is you rotate between staff as necessary, but you engage. So when we move someone into an apartment, and I'll talk about getting access to resources such as apartment in a minute, you just don't plop them into an apartment. I don't know about you, but when you move to a different area, you're isolated. And I have found it takes about 2 years to get fully acclimated. If you're homeless and I plop you into the apartment, it's a big, I'm in a safe place. But then it becomes scary and you become isolated. So we actively work with them on developing new networks, developing a bank account, looking for work, managing a household, cooking, cleaning, managing the bus systems. Most folks, if they have a car, it's a car that's going to break down if you turn around. A lot of families, if the kid is sick, they can't keep a job, or the car breaks down, they lose a job. And it's not from a lack of will or interest. It's just their resources are so thin, the smallest thing, they'll crash. So we actively work with them and getting resources and getting connected. I will probably say that we have had the majority of the folks that we work with successfully transition. There are those that no matter what you do, it's hard for them to change. You do what you know. And there are some individuals that it's very hard for them to change. The first question we ask people when they come into our program is, how did you get here? Tell me your story. And then we use an empowerment method of engagement and goal development. How do I help you help yourself? I want you to learn how to do this. I can have my goals, or my staff can have goals for you, but unless you buy into it, I'm just talking to myself. So it's getting them to buy in. And that methodology has helped the majority of our folks make progress. We do a self-sufficiency evaluation on top of the assessment to get into the coordinated entry system. And we do that to talk to the individual about how they're progressing and to show how we make a difference. 73% last year improved from when they came in. And that's significant, especially if you're chronically homeless, because you've learned how to be homeless and you're having a hard time transitioning, because being homeless, no matter what, is traumatizing. And it makes it even more difficult. And you feel like you're a victim of circumstances instead of being empowered for change. So we work very hard philosophically to help them learn to have confidence and change and stabilize. We've seen great progress. We're a small component and we're going to the health department. We're excited about that. We're very active and very invested in the folks that we house. A lot of them, when they graduate, just say, can we just help? And some of those folks are part of the committee that give their point of view about things that they need. And that's the process of empowerment. So please understand, I'm come from a mental health perspective, and that's how I approach this. I also am data-based. I also look at how people are progressing. If not, can we sit down and talk about where that's going and do our best to help it change? So rapid rehousing in a nutshell, the resources are the staff. The other resource is availability of housing. Rents have gone up. After COVID, what we're noticing is that there were 10 to 12 people a day lining up to see a new apartment. And I'm not talking about an A+ apartment. We're talking about fair market rent. So these were like B+ apartments. We develop what we have found is that it's hard to get units. But due to our strategy of working with landlords as also a client and the tenant as a client and working collaboratively together, we have found that we have 13 landlords or property owners that really advocate for our particular program. They want to work with us. They want to help specifically domestic violence families restabilize. The people in our program who are homeless get stabilized. One of the comments I make to all landlords when I interview them, I said, you never know who you're going to get. Everyone puts on their Sunday best when they go to church or they go see the doctor or they go to see an apartment. But people within a month, patterns of behavior start to unfold. And whether you are working with us or someone else, what you get with us is we're working collaboratively with you. We are engaging those folks initially once a week. And then as they progress, every 2 weeks. And if they're really doing well, once a month. And if things go sideways, we go back to once a week. And we work collaboratively with them. And we found that that works. So I really sell this philosophy, this approach, and it's working. And there are many landlords and property managers that give us glowing recommendations, even though some of our residents are not the best tenants. Most of them do well. And that's pretty much it. Nisreen gave a lot of data. We're dealing with a 1% vacancy rate for FMR apartments. The normal rate is 7%. So we're lucky to have the landlords that want to work with us and help us get housed and continue to want to work with us. So, any questions?
Mr. Penesis.
I have one question. Yeah,
Yeah.
so I see the rapid rehousing.
Yeah.
It says provides rental
Ted,
assistance for
your
up
mic.
to 12 or 24
Mr.
months.
Penesis,
Yes.
can you go to your microphone?
Oh, I'm sorry.
Yes, it's
Yeah, 12 or 24 months for the rapid rehousing?
yes.
Can it be shorter? Can it be longer? And what is the average?
Okay, the average is usually about 1 year or 2 years, and it's dependent on a couple of things. Right when someone moves and sign the lease and we start meeting with them, the first thing we say is, okay, we're helping you with your rent for the first month and security deposit. The clock is starting. Well, I just got into an apartment. I said, we get it, but you have a year or 2 years. And the 2 years is dependent upon your engagement. You're willing to work with us. If you totally blow us off, I have 120 people waiting to get into the program. I want to help you, but you have to buy into this. So we'll do what we can. So on average, it's 1 year if they just blow us off and we're trying to engage them. If they're really working with us, we'll give them the second year. And the idea is stabilization and engagement.
And then they have to move and find their own housing after that?
Many
term is through?
times, the landlords like them so much, they stay.
Excellent. Okay, good. That's
So
good to hear.
the idea is, yeah, moving all the time is destabilizing.
Right, right.
So we do have, I'm not saying all of them, but I'm saying maybe about a third landlords say, oh, we want to keep you.
Yeah.
So landlords like to make money and they like good tenants.
Yeah. Well, thank you.
Mr. Gripe.
Thank you, Mr. Chair. Learning a lot today. Thank you both for this. How long has what you guys do been in the health department? And
Is it been a month?
okay, so I thought it was new. Where was it?
It was in OCR. I was hired by Josh Beck and brought in with Scott too. And I came from a mental health and residential background, and they brought me on. I was excited to work with them, and I started this 5 years ago with Nisreen too.
I can see the correlation with the health department. What kind of promulgated the switch?
I was looking for a new department to work with, and they were looking for someone, and they said, we'd like to bring you on. I said, sure. That's how that worked.
Okay, thank you.
What do you feel is your department's greatest challenge? You said you have a department of 2 other people other than you. What is your greatest challenge?
The greatest challenge is the lack of housing resources. Okay, the housing market is very tight. 1% is daunting. Then finding apartments that are maintained by good property managers or landlords. The next problem I have, I'm so used to working with folks that are traumatized and making progress. To me, that's like, oh, pshaw, we'll work with you and we'll help you make progress. So to me, that's a walk in the park, and it's just standard operation. So it's the resource of getting access to housing. The other thing is we applied for a domestic violence grant, and both my staff are certified in it. And I've had 35 years in mental health. It's getting the training, getting access. The domestic violence shelters work very hard to get people housed, and they're still overwhelmed. And so it's expanding those resources. And I'm honored to say that the landlords that work with us want to keep working with us because of how we operate.
I, for one, am very impressed by our presentation or your presentation today. Would welcome an opportunity to have the whole board hear this as well. So perhaps committee of the whole meeting or something, so that we can all stay in tune to what's happening.
Thank you.
Thank you for your work.
And by the way, Nisreen is awesome. So just want to say that.
You're both awesome. Yeah.
I was to get a couple questions here. OCR was part of the Office of what was that called? OCR? Because that was actually
Community reinvestment.
because that was actually part of the Jobs Committee. And now that got moved into public health.
He got
Can
divided.
someone explain that again? I
Yeah,
mean,
he
how
got
it all
divided
happened? Oh, you
between-
can?
I
Okay.
can, yeah.
Thank
Okay.
you.
So the Office of Community Reinvestment.
Microphone.
I'm not tall. So the Office of Community Reinvestment kind of acts as a funnel for state and federal resources into the community for a variety of activities. So within OCR, there was Workforce Development Division and then Community Development. I was part of Community Development, and so was Rick. So Workforce Development became its own department now. And then 2 or 3 of the programs for community development. So the home program, CDBG, and the Grand Victoria Riverboat Fund went over to Mark Van Kerkhoff in community development and community services and development. And then COC and rapid rehousing have went over to the health department. So that's how we ended up here.
Yes, sir.
For the next committee meeting, could you guys bring up like maybe a chart of the organization of what public health is now that OCR and this part of OCR is funneled into it?
Flow chart of how the.
Yeah,
department
where
works, the
everybody
committee,
fits. Yeah. Thank
public
you.
health.
Yep, I'll bring that back to Michael.
Thank you very much for coming back up. All right, moving along then, is there any old business? Seeing none, is there any new business? David.
Hi, David Young. Okay, I brought this up at the last public health committee meeting, and we talk about things that affect very few people. Okay, we had the measles that affected no one in Kane County, right? We spent how many like 30 minutes talking about this. We're talking about homelessness. Yes, that affects people, affects 500 roughly people based upon the last data, 0.1% of Kane County. Okay. This is public health. When are we going to start talking about stuff that affects us all? I mean, this from the CDC, I've got some facts here. Heart disease and stroke. Heart disease itself is the #1 cause of death. Okay, it's more than, it says more than here, over 1/3 of the deaths in the country. So why aren't we talking about, hey, what can we do to reduce heart disease in Kane County? What can we do to reduce obesity? Child obesity is a big problem these days. But what can we do as public health in this public health committee? What can we do to educate people on, first of all, what are the risks? And secondly, what can we do as a community to reduce the risks? Because that affects a lot more people than a measles outbreak or homelessness. So I'll keep on asking for this. And I hopefully we can talk about something that is going to be really for the benefit of more and more people. Thank you.
You're welcome. And perhaps that's something for Mr. Isaacson at a later time. Thank you. Okay. Can I get a motion to put the reports on file, please?
Sanchez asked for unanimous consent to place reports on file.
All in favor?
Or no-
Aye.
no
Aye.
objection.
No objections. Thank you, Mr. Sanchez. Next, then, we do have a need for executive session. So if I could get a motion to go into executive session for review of release of closed session minutes.
I move that we go to closed session.
Second.
Thank you, gentlemen.
Mr. Chair, point of order. I got this question from an employee, and before some of you depart, maybe our state's attorney could address. There were some employees related to, county employees related to what the committee was doing that heard we're going to executive session, and they said, well, we all have to leave. And I said, I'm not sure about that. Stephen, could you possibly clarify when we say, or when a committee goes to open session, who can stay and who can't?
Stephen Ford from the State's Attorney's Office. So ultimately, the answer is it's up to the body to determine who's entitled to stay in closed session or not. I don't want to speak for the office for all instances, but we would always recommend, or I would recommend that the people who are in the room for executive session are the amount of people that are there for the need that the body's in. So that way it keeps a clear record. There's some administrative convenience in having the recording secretary, the attorney presenting, but ultimately when you're discussing things that have a need for confidentiality, the people in the room should be there who the body feels must be there, would be my recommendation.
Thank you.
Mr. Chair, if I could clarify, just so I'm for clarification, so the elected board can determine who is needed to stay and who is not, and it's ultimately the board's decision.
At the end of the day, yeah,
Thank
it's up to the body.
Okay, then can I get a, Mr. Young seconded it, right? Yes, and then can I get a roll call to go into executive session?
Juby,
Judy, I.
Hennessis,
Hennessis, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Tarver.
Yeah, you're good.
No, you're good. Thank you. Thank you.
I don't know. I left it there. I had printed one. I know,
Oh.
those are there. I picked one, I printed one. Oh, thank you. Hi, Kim.
Do you have any of those?
Go anywhere on vacation? You been anywhere?
Yeah.
Where'd you go?
That's where I was going.
Yeah, that's what I figured.
Oh, yes.
Oh,
Yes.
yes. I'm
that
going
okay?
Monday. Yeah. My
Yeah.
wife's
Yeah, I
uncle
know.
races the Mac out. So they're going up there. They're doing their.
All right, everybody online that's joining us for the closed session, please accept the
Oh.
invites.
Yeah.
I'll let you know when we're ready to go.
Find 'em. So we ended up Tarp Lake, which is like
Yeah.
15 minutes south. Hey, I found an Airbnb 15 minutes south. But yeah. I haven't been there since I was 10 years old. I was a little kid. I don't even remember.
Whatever.
Okay, sorry.
Same with me.
Yeah.
And
I printed one.
I love
I
it.
go
And
back, it's like,
we got
I
it.
only printed.
I'm missing some individuals in the room that need to accept the invite, and I believe one person that is online needs to accept the
Oh, I didn't
invite.
even look at it. Yeah, I was like,
Oh, so when you get off the ferry, the island house
Thank
is
you.
like right to the right.
We ready, Blair?
And
Or should I
I
play
hate
it?
those
Nope,
instruments.
okay. He'll call it.
Thanks, Stephen.
To print this.
Yes.
so you need to
Yes,
get, we're
sir.
on a bike.
yeah, I-6.
Steve Ford? Yeah. Are you sober right now? Are you sober right now, Steve Ford? Okay.
Back with
Okay, so go to YouTube because this video, it talks about all the haunted places.
it's nice of you. to come
All
back.
right, you are in open session.
Yeah. That's when they went this house hunting team went there like right before, actually right when it closed in the fall, like winter fall.
Clerk, can you do roll call, please?
Workers.
Juby,
Juby here.
Genesis,
Hennis is here.
Young.
Here.
Sanchez,
Sanchez present.
Carver.
Tarver's here. Thank you, everybody. Can I get a motion to release the closed session minutes, please?
Sanchez moves.
Second.
Seconded by Mr. Young, and then roll call, please.
Juby,
Juby, I.
Genesis,
Hennis is yes.
Sanchez,
Sanchez, yes.
Young,
Yes.
Carver.
Tarver, yes. Excellent. Thank you. And then can we get a motion to adjourn?
Wait, one.
Oh, yes, Mr. Roth.
I heard here say that there's going to be a 10 out of King County Fair with public health. And it was very well run last year. So I will try to stop by today when I'm out there.
Yes, and anyone else?
I
feel
think
free
it's
to-
important to thank the people for being there. So
Thank you.
every time I'm out there, I try to stop by.
Where is it on the ground?
I'm not exactly sure.
Are you
where
the
we're-
same place as last year or?
I'm not sure exactly where we're located, but we will be there with a camera crew because we have promotional things going on for mental health, behavioral health. So you'll probably see a spectacle.
I'm always impressed. I think it's run very well. So I just wanted to
you.
share that with you guys.
Thank you.
Awesome.
You're welcome.
Can I get a motion to adjourn, please?
Hennis moves to adjourn.
Sanchez seconds.
All in favor?
Aye.
Aye.
Thank you.